Hi, Dr. Shevers. How are you today?
Good. How are you?
Good. What did you want to talk about today?
Today I'd like to talk about the long-term effects of untreated whiplash, actually.
Okay.
How so many people get in car accidents or slip and fall or, take a headshot playing some kind of sport, and their neck's a little stiff or a little sore, and they go to their GP, and he gives them some ibuprofen and maybe some Flexerol and tells them just to go home and rest and ice it. And, slowly over time, the symptom of pain typically, over 3 or 4 weeks will go away if that's how you treat the condition. And the problem with that is often when you've had that whiplash injury, you've actually straightened out the cervical spine and eliminated the natural curvature. And as you eliminate that natural curvature, the joints are actually set up to work with that curve in the spine. And as they start to work incorrectly, because the spine is straightened, you start to get arthritis. Once the arthritis develops, that accident when you were 25 or 30, and now you're 52 and coming in because you've got chronic neck pain, it becomes something that we're from treating to correct, that you're going to walk out of the office in 4 or 6 weeks and be absolutely perfectly better, to we're managing pain. We're no longer fixing the problem, because essentially you'd just let pain dictate your care, and then your spine has actually started to degenerate, at which point all we can do is help you with the pain rather than fix the problem. So it's really critical when you have these kind of injuries to get in to see a chiropractor and get the problem dealt with properly in the first place, so it doesn't lead to a lot of health concerns later on.
Wow. I didn't realize that, actually. I mean, I think I knew, but I wasn't thinking about it to that extent. So do you have people come into you now that maybe it's been too long since they had the accident, and then
all
now
the time we have people that come in that are otherwise, they're a 45-year-old man who is still playing tennis 2 or 3 times a week, still going to the gym, and, he can't figure out why his neck's hurting, and he's, gone through the whole thing at work and had his station set up, and, he's kind of eliminated everything and done things right and can't figure out why it's still really bothering him, and he doesn't want to live on, 10 ibuprofens a day.
Sure.
And they come in and, you take an x-ray, and they've got the spine of a 68-year-old, and you say to them, well, what have you done? Have you been in an accident? And, most of the time they kind of stare at you blankly and, no, I haven't done anything. Well, and you go, well, this is really typical of, an old injury. Then you've treated them 2 or 3 times, and you're working your way along, and then all of a sudden they come in, they go, I forgot. I had a rollover accident when I was 22. And you say, well, what did you do? And they say, well, I was fine. I didn't have insurance. I got up and, I iced it and took some painkillers, and, a week later I was fine. And then all you can say to them is, well, you weren't really fine, and, now you get to come see me once every 2 weeks, whether you like it or not.
Well, there's a question that comes to mind. Why does the pain go away if their neck or whatever, the curve's gone away? How can the pain go away so quickly? I would think that throughout the years there would be some pain that would come, show up.
Most of the pain is caused by inflammation. kind of bone rubbing on bone there's not a lot of pain receptors there. The pain comes from the swelling, pinching the nerves. Your body also does a remarkably good job of adapting, especially with your neck, because it's very important that your eyes are looking forward and are level. So your body adapts quite quickly and will start to lay down bone in areas that it think it's getting worn too much. You also, when you're young, have very healthy discs that are filled with fluid that can, that make up a lot of that slack. As you get older, those discs desiccate, and there's absolutely nothing that can be done the discs have no blood supply, so there is no increasing the disc volume as it starts to dry out as you get older, and the problem just starts to compound itself because the body can no longer adapt the way it did when you were 24.
Wow. Boy, that is certainly food for thought. Well, for me, I have, for years, if I ever had an accident, I'd go to the chiropractor. But when I was younger, I didn't even know. Well, I knew what a chiropractor was, but I wasn't that familiar. So I'm thinking about some of the accidents that I had before. But yeah, but it's interesting that I'm in really good shape. So I don't know, if I was, I don't know. Maybe I was just fortunate. I know years ago, the last time I had X-rays, that the chiropractor showed me, that he couldn't see any arthritis in my spine, which was, of course, it's been about 15 years ago, and so I'm really thinking about myself now. I suppose that if a person has problems, let's say like this gentleman you were talking to me about, but he's not having any pain or anything, then he's probably okay. I mean, I know you can't commit, but probably, right?
I do not. Pain is on most problems like that, pain is the last thing to appear. It is also the first thing to go away. Just because you're not hurting doesn't mean the problem is no longer there, especially when it relates to the spine, because so many of the pain symptoms that come when it's a neck or low back issue are actually caused by the swelling that then pinches on the nerve. You can get rid of the pain by eliminating the swelling that's bothering the nerve. That doesn't necessarily mean that you have the spine back in its proper position with its proper curves working properly. It just means there's no swelling pinching on the nerve causing pain.
Right. Well, my chiropractor uses, because I'd be going to you if I lived in California, but I live in Tampa. My chiropractor uses muscle testing and kinesiology to test, to see what's going on. And I'm trusting, but next time I see him, I'm going to talk to him. Well, this gentleman that you said he was 22 when he had this accident?
Yeah.
Is that what you said? If he would have come to you sooner, I mean, maybe not right after the accident, but let's say 10, even if it was just maybe 5 or 10
more
years.
Like in his 30s, yes, you would certainly be able to have, if somebody's coming in and, if you look at an X-ray, often you can see where an area where it's just whiter and the body's just laid down some extra bone. As long as it hasn't fused or done anything really crazy, it's just, tried to protect itself from the injury. It is very correctable. Now, that does happen as well. Somebody gets hurt at 20, 22, 23, comes in at 32 when they're starting to get back in shape, and they're like, I don't know why my neck keeps getting sore, and it doesn't really make sense. And you take an X-ray, and you're like, oh, yeah, and you can see that it's straight. And, yes, often at that point you can still definitely recorrect the recorrect the problem. It's only, it's typically much later that you can't recorrect the problem.
Oh, okay. Well, that'll probably explain my situation then. That whatever I had when I had my accidents, that then when I went to the chiropractor, it was soon enough. Because I'm talking a lot of years ago, So good, because you had me worried there. Let's see. So this person that you were telling me about, how's he doing now? How's that going for him?
We've got him now down to, to kind of keep it in check and make sure that he can play his golf and do everything. I see him between once every, it probably averages out over the year to about once every 3 weeks, and that keeps it in control. Every now and then it flares up a little more than normal, and I have to see him once a week for a couple of weeks, and every now and then it doesn't bother him at all, and he goes 6 or 8 weeks without a visit.
Yeah, so probably people that don't go to a chiropractor or do something similar are just living on using painkillers in order to live through life.
Often people do just live on, there is a reason that people call ibuprofen vitamin I, and it is because there are definitely people that basically live on it.
Wow. Well, that's a whole other topic there, right? Maybe we can talk about that next week. We can talk about painkillers. It just occurred to me that, if we could talk about that now, and that's probably a pretty long discussion we could have about it, because I know people are usually shocked when I tell them I haven't taken a painkiller in years, and even when I had an accident where I fell after my here in my house, and I was hurt pretty bad, and I didn't even go to the emergency room. I waited till Monday because I didn't want to be traumatized, and I didn't take any. I was going to take it, and my cousin brought it to me, and I lost it. So I just through meditation and different ways, I didn't take any pain medication. And then on Monday when I did go to my therapist or whatever, who's also, her husband's a chiropractor, so she was able to check me out and stuff and got me, getting everything back where it was supposed to be and all of that. And so then I didn't use it. But I understand, it's kind of like we're in such a habit of using painkillers. But now I'm going to start talking about it, and then you'll be talking about it. So we'll end this for now, so it's not too long. And thank you for talking to us today.
Perfect. Thank you.
Okay. Bye.
Bye.